Hello, my name is Dan Apple. I am a former Kresge Vitreous Retinal Surgery Fellow at the Institute from 2016 to 2018. I am currently in a private practice in a retina-only group in Greenville, South Carolina. Um, I'm very grateful to have had the opportunity to train at Kresge Eye Institute, and there are a lot of really great things about the program, and many other people will tell you it's the sort of complexity of pathology. Um, the attendings are fantastic, and I too am going to touch on those very common themes that you'll hear a lot in talking to some of my. But I wanted to take the time to sort of approach this from a different angle. Um, I tried to put myself in the shoes of an interviewee considering training at Kresge. And I remember that there were some hesitations, I think largely surrounding the fact that Kresge is located in the heart of downtown Detroit, Michigan. But I feel like that is actually probably the foundation to Kresge's greatness. It, it's definitely a strength to the program. Um, I totally understand the initial impression about Detroit. Detroit has definitely been through some stuff. I grew up in Michigan, about an hour outside of Detroit, and I always tell people we never really went into the city for anything other than maybe a professional sporting event, or a show, or the North American International Auto Show maybe once a year, and we promptly left. And I did my medical training in undergrad in other places. So coming back to Detroit, there was admittedly a little bit of trepidation about that, not only for me, but I think for my wife. Um, but during my interview, and obviously having lived there through my fellowship training, this is not the Detroit that I grew up knowing. Detroit is going through an incredible transformation and revitalization of the downtown area. It's really amazing. There are so many good restaurants, breweries, coffee shops, all these things that there's so much growth happening there, and so many people are moving into the city, which was just unheard of when I was growing up there. Um, my wife and I consider ourselves to be foodies, and some of our favorite restaurants that we've ever eaten at are still in Detroit. Um, it's got a little bit of everything. The sports teams, there's tons of urban parks, green spaces, and I think that the fact that this year the interviews are virtual. It's unfortunate because this does not give you the opportunity to come and visit this city. It's just a remarkable city, and I think that that is definitely a positive for Kresge Eye Institute. Also, because of that its location in Detroit, you do get to see a unique patient population. Many of the patients there have had, um, for one reason or another, poor access to care, or care, and because of that, these folks come in with tremendously complex pathology. I always told people that you just see end stage disease, fill in the blank, end stage diabetic eye disease, um, retinal detachments. This gives you a opportunity to become very comfortable with these incredibly challenging cases, not only in the clinical setting, but also in the surgical setting. Um, and it's just an incredible learning opportunity as a result. And not only you get comfortable seeing them and managing them, you are being monitored by attendings that see these every day and have been done this for years to guide you along and to train you to train to teach to treat them right. Um, the attendings are certainly a strength at the institute that you have these very experienced and adept um, practitioners who are available and very approachable, but they also give you the autonomy that I think is really valuable as a Kresge fellow. Um, and you're never going to have any attendings that are going to be mean to you or anything like that. They're not dumping on you. They are treat you with respect as a doctor, which is what you are, and are always available. And they're the ones that are giving you these cases. They give you all their surgeries, and because of that, Kresge tends to be a very surgically centric fellowship. There's not a medical year and a surgical year. You are in surgeries from the beginning. So from week one, you will be in the operating room, sitting in the operating chair, going as far as you can, which is not very far at first, but it helps you to grow into the role of a surgeon pretty organically, and also gives you the opportunity to see these patients as they are in the recovery and post-operative phase. And I think that's a really important thing. Um, the As we discussed, the surgeries there are often very complex. I think that I remember when I was on my fellowship trail, there was so much focus on the quantity, the number of surgeries that you get as a primary surgeon. And Kresge is certainly very high, above average around the country. But I think there's so much more to just numbers. You got to think about the quality of the surgeries. That these are not just, you're not going to do 1,000 macular puckers and macular holes. These are complex TRD, RRDs, PVR cases that not only by the time when you're finishing up your fellowship, you will feel comfortable. You're not learning how to do them. You're learning how to be better and more efficient at doing them. Um, and these are the cases now, as I'm in practice, that tend to strike a little fear in your heart. And as a provider, you become adept at them. You become comfortable with them. Um, Also, along the line of surgical experience, you're going to become adept at scleral buckling, which, as we know, is an art form that unfortunately is not done as much or taught as much. But at Kresge, it's a scleral buckle. Um, I guess the quantity of scleral buckles is pretty high, and you'll become not only comfortable doing combination buckle vitrectomy, scleral buckles. And again, those nowadays are the thing that I know, talking to colleagues around the country, those are the things that make us a little more nervous as we approach those cases. But at Kresge, you will become comfortable doing that, and you'll have plenty of opportunity to do those. You'll also do secondary IOLs. At Kresge, the retina service handles all secondary IOLs. And that's just an important skill to have in your armamentarium as you go out to your practice. Um, so not only do you have great surgical experience, you'll have a great clinical experience as well. We staffed the resident clinic, which was, you just never knew it was going to walk in those days, and is always just fascinating to see the pathology coming in, and lots of lasers. We did tons of PRP, even some focals, which is not as frequently done as anymore, but did those quite a bit. Pneumatic retinopexy is something that we did a decent amount of as well. So the clinical experience there, and from what I understand, it's even better than when I was there. Now that Dr. Lin is doing his uveitis clinic, I really wish that I had that when I was there, because Uveitis is something that unfortunately we are sent a lot of in as retinal um, specialists, whether we like it or not. So, um, I think another important thing is the overall work-life balance as a Kresge Retina Fellow was quite good. When you're in the clinics and you're in the OR, you're busy, and that's great. But when you weren't, it wasn't all that bad. The call responsibilities were very favorable for us. We did retina call. We weren't on call for the open globes and things like that. And you cannot underestimate the value of having good residents working with you. The residents at Kresge Institute are excellent. They triage the pathology appropriately. They get in touch with you, um, yeah, on an appropriate basis. And they really were the first line to seeing any of these patients coming in, and they made our lives much better. And I think that's an important thing to take into consideration as you're looking at fellowships. Because that can really make your life a lot easier. And at Kresge, they had that. Um, in general, I think Kresge is a fantastic program. Can't say enough good things about it. I am certainly thankful for the opportunity I had to train there. And if you have the opportunity to train there, you will come out very well prepared for whatever type of practice you are in. Um, So good luck. Congratulations again. Look forward to working with you all as colleagues in the field of retina. And certainly don't hesitate to reach out to me personally if you have any questions that you'd like to ask specifically about Kresge.